Hello, hello, and welcome to today's podcast episode of Physicians Fame. I'm your host, Dr. Erika, your IMG mentor, and today we are with a very distinguished guest. Thank you so much for joining us, Dr. Jody Reed.
Thank you for having me.
Dr. Jody is a psychiatrist from Chicago, is that correct?
Yes, Chicago.
Awesome. And could you give us a little more introduction about yourself?
Well, I've grown up in Chicago, and I've been doing this for around 25 years. And it's a incredibly rewarding occupation. You know, taking care of patients is an extremely important and valuable role in this community, and it provides a lot of services and help to people in need. So, hey, it's 25 years.
Wow. It's definitely been a journey throughout that trajectory of your career, right?
Yes.
Wow, that's amazing. And getting to, if you don't mind me asking, getting to that place of being a psychiatrist, how was your journey like, you know, as medical student, resident, even as your beginning years of psychiatry? What was that journey like, Dr. Reed?
Yeah, it's an amazing journey. You grow so much. You know, it's unforgettable. But I would sort of describe it as being in stages. And so this level you're at in medical school, you know, this is your birth. You're sort of formulating your new ideas now and sort of getting a hold of the language and things like that. That's the first stage. Then you're going to go into residency, then you're going to start practicing, and then you're going to get into your field and start growing, you know. But each one of those stages are very interesting. They're very unique. They have their challenges of their own. And I was just glad that each one of those steps were just very rewarding for me. So I think it'll be a very incredibly rewarding experience for a lot of people in these different stages.
No, definitely. And they're very formative. Did you see yourself, you essentially saw yourself as a different person at every stage of that educational trajectory, correct?
I am so fortunate I had mentors that I can look up, and so I would sort of model that behavior and take the things that they were doing and sort of try to incorporate those things into my practice. And I do it today. Anytime I read articles or journals or read other physicians' documentations or their works, when they express things certain ways, or there are strategies of addressing certain disease processes, all these things are just amazing, and I will take it.
Yeah, definitely.
I think my career, and I think every young physician, it's a collection of all the things that the people who wanted to teach you that you've incorporated into who you are as a person. You know, that's actually how your ego is formed. Mm-hmm. It's originally formed from the attendings and the doctors around you and all the standards that they have. You internalize those standards, and at some point you'll be able to operate independently without crossing boundaries because you've learned all those lessons, and most importantly, you've incorporated all the tools into what you do for a living. So.
Wow, definitely. So I think it's a really great way that you describe the individual as a physician. You know, they're not just the sum of their education, but they're also the sum of everybody they've interacted and you know, the good, the bad, but essentially, you know, just really everything from
you're absolutely right.
Experiences.
You know, and then I'm not sure which one is useful, the good or the bad.
Right. Yeah. Sometimes, yes.
Yeah, the things that you think are actually good may not work out for you in certain situations as a physician. What's good for you now may simply be a perspective that you'll detach from at a different stage of your career. Mm-hmm. You know, and then what's bad, you know, I always thought that like things like judgment and things like that were bad. Like, you're not supposed to judge people, you're supposed to do all these things, and it's hard for me to understand not when I'm a psychiatrist and I need to look at those things you're doing to get an understanding of who you are.
Right.
And so I always thought judging people was bad. And so how are you going to treat people? How are you going to tell them about, how are you going to confront them? You know, tell them about their problems, tell them about how much bad they're doing if you can't even perceive them in a negative way. So some of the things that are bad may not even be bad at all. So it's gonna, and then the issues you bring to the table will certainly limit your capacity to function as a physician, and you cannot help anyone further than where you left off. You can't push anyone higher than you are.
Right, definitely.
You know? So the good, the bad, that's a complex problem. And I think each individual physician is going to have to take a look at that and figure out what to do.
No, definitely. And it's something I've been noticing throughout the trajectory of my medical education. Or just universally, I've been coming to see that it's not always linear. You have your good, but then sometimes the bad experiences kind of ultimately end up becoming redirections into something that ultimately becomes more favorable. Have you noticed instances like that happening?
Oh, I mean, that's actually the process of growth, and it happens all the time.
Definitely.
It's just that the person doesn't have awareness of what's going on. These things that you are attached to, you need to let go, because as time moves on, you become distant from all these objects you were previously associated with, and you have to be able to let them go. If you can't let these things go, then these attachments create emotional and psychological distress, right? And when you finally get over it, you are relieved of the emotional and psychological discomfort only because you let go. Right, you detach from that issue, and so people who are actually fortunate enough to overcome some of those blocks that they have, they appreciate it and they can identify it. For example, let's say someone who gets out of a bad relationship. I would never go back to a relationship like that. Right. So it's a person's pronouncing that I will never have those type of attachments again. So meaning I'm gonna protect myself in the future by not being inappropriate and crossing boundary by attaching to things that I'm not associated with.
Right. So it essentially, you're saying that the realization, the growth is where the growth process is really where that realization happens. I don't necessarily want to say interchangeable, but it's another perspective. It's another way of seeing it. One could say it's redirection, but it's actually the process of growth. And did you ever have any experiences like that going through, again, your educational or professional career, Dr. Reed?
I think all of us have them, and if you're going to be successful at anything, you have to actually deal with those things. I'm saying, and these things are very challenging to deal with, and our healthcare system or mental health, it really doesn't help us deal with that well. I think each individual need to go on their own quest to try to find solutions, and I think that this system should have something easier for them to access the type of care that they need, the specific type of care to help with those type of attachments that are creating so much emotional, psychological pain that they can't move forward.
And what do you think are some of those ways, or what do you think are some methods to facilitate that detachment and really just kind of catalyze that growth?
I think that our healthcare system and that's embedded in our economy, that's embedded in our society, will experience significant shifts because everything is moving now. I'm not sure what the answer is going to be, but I think it's going to, the solutions we come up with will be on a scale significantly more improvement than we will have now. I think the advent of AI into medicine is one of those solutions, because you can simply ask an AI, what type of care do I need? Well, let's say I'm in this relationship. It's not going well. I'm having these feelings. What type of doctor I would need, or what type of care? And I'm sure an AI will be able to say, hey, you will probably need a neuropsychiatrist, or you need someone for domestic violence, or someone who specializes in personality disorders, right? Definitely. Now, you can get an answer right there instantly. And so I think the adopting AI in healthcare can give these people immediate answers, and also find a referral source, where here are the referral sources that do that.
No, definitely.
So I think that the changes in the future, it's going to be significant changes.
Oh, of course. And that's actually something I wanted to touch up on as well, because you're an established physician with decades of experience. Myself and colleagues, we're kind of on the beginning stage, like we mentioned earlier. You've definitely noticed differences between individuals who are going through medicine now versus individuals who went through medicine when you were a student as well. One of the biggest being AI, you would say, right?
Oh my God, amazing. Yes. I think I wouldn't go back I would stay here, but because we're adopting AI into our practice, and it's been a very rewarding process. It's something that's weird that happens with AI when physicians start to deal with AI, and I'm not sure anybody understands this. And this is the challenge. These are the issues that we're contemplating, and these issues sound bizarre. So let me just post it to you and just get your reaction to what I'm about to say. When you talk about physicians coupling with AI.
Right. Because, sometimes people think it could be an asset. Others think it could be, it could go one of two ways.
See, I think it can go one way.
One way.
And one way only.
Okay.
And that's up.
Okay.
I think the physicians now will be heroes. I think they'll be international figures. I think the AI is going to make you a specialist for the entire planet. And I think that the skill set that you build, an AI will make that directly available to everyone on the planet. And I believe the AI will be able to take care of all of your patients simultaneously. Right? So one of the things we sort of specialize is building the platforms that allow us to collect the healthcare data to be able to collect enough of it in a structured way so that you can add your own AI on top of it. You simply need tons and tons of data. So imagine 20 years of work keeping your own records and then being able to put an AI on top of that. That 20 years of work is you.
No, definitely.
I would say it's more like your higher self, right?
Right, just really enhancing your abilities as a physician so that you can provide to more individuals.
Exactly. Let me just take it back a little bit to show the process. And so let's say 25, I've never worked with anyone else. I've always worked by myself.
You have your own practice.
So I have 25 years of our own records for my patients, and so that's more than enough data that I've collected to run our AI, and then our AI looks at all this data and helps us understand what to do next. This is going to live forever, right? So when we launch our AI, it's going to start autonomously taking care of people and doing all these things, but at some point I'm gonna pass away, right? But my version of my software is still going to be taking care of patients. I'm not sure if I'm going to be the first physician who takes care of patients after my physical death. And that's what all of us physicians are going to have to start dealing with now. This idea of service after life. Afterlife services. You see what I'm saying?
Well, I think it's a really good take, because one of the biggest motivators for anybody, regardless of their level of career, their position, whether you're a pre-med, a med student, a resident, one of the greatest driving factors is the physician discrepancy. There are little physicians. There's the ratio of physician to patient is quite large, and there's only so much that you can provide as a person to your public, to your peers. People who are going into medicine are going because they want to provide, they want to be of service for their community. And so the way, the way you're seeing this is not only just something that can be a benefit to you, but also help others throughout generations is really what you're saying.
I don't think there will be any physicians without an agent in the future. Because the agent does all the labor, right? In this healthcare system, you have the business of it, which it seems to be the entity that basically controls everything, and then you have the physicians who basically, work within that system and things like that. But they put all the labor upon us. Right, that's the detailed documentations of all of things like that. Well, with with an AI, then the AI takes the history. The AI does the interview.
Definitely.
The AI writes the note. The AI developed a treatment plan.
And that's where you see the trajectory of medicine.
Right. Because once my AI is launched, then my patients just need to talk to my AI to get access to me, and they'll get a response instantly and what they need instantly.
Again, I think it's such a fantastic take, because, as I said, it's an extension of you. You know, it's not its own autonomous system. It's not necessarily an algorithm that came out of the blue.
I know that's the interesting thing about that. So I'm thinking about this concept of physicians having the AI, and it's been difficult for me to even say these things or even think about them, because I'm like, I can't believe we've gotten to this point where I'm thinking about my AI practicing after my death. And it's like, and then how long is this thing going to go on?
Exactly.
It's AI. I mean, what? Right. So you mean to tell me my AI is going to see many more patients than I ever seen?
For generations,
for more years than I ever. And then who owns it as an asset?
Right, and that's something. Right, and that's kind of something I was really curious to know about too, because again, one of the biggest points, not necessarily against AI, but sometimes people have either the misconception or the or the counter perspective of AI, where they think people use it as a crutch. And as we established right now, this AI system will not be a crutch. It's essentially an extension of you that will be providing for future generations. How can we distinguish, those drawbacks of the potential perspective of AI being a crutch, or essentially if it is an algorithm, if the algorithm derails?
Yeah, I see what you're saying. Let me just take you back to a broader concept to see if I can give you this concept and that it makes that what you just mentioned makes sense. Okay, let's go back. COVID-19 represented the end of the Industrial Revolution. Right? And it's the beginning of the information age.
Correct.
Okay, in the Industrial Revolution, the capitalists, they owned the factors of productions. They owned the factories, the railroads, the hospitals, the banks, and things like that. And they imposed a certain matrix or structure upon everybody who needed those to survive in our society. And everybody worked for them, and they got all the profits. But in the information age, I don't think it's going to be like that. I think in the information age, they will not be able to take your work away from you. Right, the products of your work away from you. Right, I think you'll keep the products of your labor. Right, I think work is when you're giving someone else your profits. I think labor is when you're keeping your profits. Right, and I think AI in the information age is going to be the one factor that allows that shift. So for example, you take 10 years starting off to create perfect records for a patient. I mean, it's tough to do. It's a dedicated do, but you want the quality of all your data to be there. And then this data set represents you. All your thoughts, all your feelings, all your emotions. There's an aspect of AI called learning language models, and it can understand the context of the speech. Right. And so when you're writing all these notes, it understands the language and the content.
Right.
So it can rewrite your notes in the future.
I think that's such an amazing perspective. Again, just the potential of using AI. I'm really eager to see how that trajectory goes. It's amazing.
It's going to change everything.
Definitely.
You guys are going to have the best lives as physicians ever. And I think it's going to change everything.
And if you were to be a practicing physician or a medical student, either a medical student or practicing physician, either now to couple hundred years from now when AI is fully established, which would you prefer to be? They're practicing now, practicing then, or are there still many unknowns to come up with it?
I like me. I like me.
I like where I'm at.
I'm like, I ain't going to the future being somebody else or being me in the future. No, it may not work that way.
That's true. Because then again, if you were
a singer or something like that.
No, definitely. That's definitely true. Because if you were at another time, you could have very well not cross this venture because it was already established too.
Yeah.
That's totally, no, that I totally get that, Dr. Reed.
So, but this AI is going to be amazing because it can tend to my patient's needs and do things for me. If my patient needs return to work letters or prescriptions or documentations or disability paperwork, it can do it and just send me a notification to improve it. And now the patient can get what they need from home and then move on. And they don't have to make an appointment, come in, wait and hear all that stuff. It's too much.
Definitely. And
so you guys are going to be rock stars. You guys are going to be, I mean, it's going to be amazing because it's going to be a combination of AI and streaming.
Yeah, definitely. Well, I mean, it takes rock stars to establish future generations of them. So I think that's really amazing. And like I said, I'm excited to see where that trajectory goes.
I'm sure you are.
Definitely. And
I'm sure you are.
And something else I wanted to touch up as well, Dr. Reed, I know you're a psychiatrist, but you're also a very big psychology junkie as well, right?
Yeah, the whole mental health issue is very interesting. It's a very interesting subject.
Definitely. And if you don't mind just touching up really quick on the difference between psychology and psychiatry. I know you use both of them are essentially intertwined in your practice, but how would you distinguish the two?
I think the area I work in is that there are not many providers, and so I have to be able to do counseling. I think all psychiatrists are able to do counseling therapy, psychological testing, neuropsych testing. Because I'm by myself, I have to be able to answer problems. And so the psychological component comes from a lot of theories like cognitive behavior therapy or didactic behavior therapy or concepts of the self. These are like theories that you can help people understand, and it helps them deal with their own emotional and psychological disturbances. So basically I had to learn a lot of these things by over time learning the interests and conferences and things like that.
Wow. So you have multiple hats in your practice.
Yes, let me give you, so young physicians, if I can give you some advice, basically really refresh your STEM. Things like organic chemistry, things like calculus, those things are so fundamental to everything. And if you have a full understanding of those, then you have the ability to pivot in almost any direction as this thing moves forwards and change. Okay, so that's the first thing. The second is that I think you're going to have to learn how to write code. And so I think this hybrid physician coder.
Right.
I think that because the coding is going to give you access to the language behind the AI. And now the whole thing is discoverable.
Wow, no, definitely.
So I would encourage basically become fascinated with the stem cells, because that's the base of all this. And the second question, I forgot the second part. Well, it's a pleasure. It's a pleasure. Thank you so much for inviting me. It's a pleasure to meet you, and I wish you guys the best.
No, definitely.
It's going to be so exciting for you, though. It's so exciting. Trust me. And then another thing is, I think with students you're going through school, there are no evil people out there. It's just narcissists. Everybody out there will actually support you and everything. So some of the worries or the fears that students have, I would just let that go.
Right. Just
let that go.
Just really
just enjoy that. You guys are going to be rock stars. There will never be physicians like you guys again. You guys, they're about to make a population of first AI generated physicians that are going to improve everybody. It's going to be huge changes. Changes.
Definitely. And I really love the way you're pioneering that theme. You're kind of again trailblazing the integration of technology and practice. You started your own practice as well again, so it's that also goes hand in hand with having an entrepreneurial mindset, you would say, right?
Absolutely.
Absolutely. Definitely. And so if you don't mind me asking again, essentially outside of being a physician, how has your entrepreneurial journey been?
I never wanted to work for anyone. I never wanted to be an employee. So I've just always worked by myself in my private practice, and it allowed me to travel and do a lot of different things. A lot of different things.
Just expose yourself to a lot. And was it easy? If you don't mind me asking, did you start with assistance? Was everything
it was brutal.
Organic?
No, it was brutal. Every entrepreneurial experience is brutal at everything, and it drains all your resources. It bankrupts you. It isolates you. The years in my office by myself to 11 to 1 in the morning, working and doing things. And so I think every entrepreneur, it's like maybe a 10-year stretch where you're just in isolation, not knowing what's going on.
Wow.
And you don't know whether or not you're going to make it or not. I think that's the best route to take. For me, now, if you want to be an employee to get a guaranteed check and follow someone else's rules, work within some type of structure, that's fine. My route is not for everyone.
Right. And so it just really depends on the journey you want to take. And again, like we stated earlier, those redirections, just really being tenacious, and that could apply whether it is in a clinical setting or otherwise, right, Dr. Reed? No, well, I really appreciate, again, all of your insights that you shared today. It just gets me, like I said, excited to look forward to the future generations of healthcare. Again, the fact that trailblazers, both either in the technology age or encouraging people to have entrepreneurial ventures on top of, in addition to being physicians, the fact that there can be a balance between the two, I think is amazing, because
it's going to have to be absolutely necessary. It's necessary. You have to find the balance, otherwise you're going to tip over.
Right. And it's all about balance, finding that balance, and I really appreciate the way you're modeling this for everybody. Again, I think this is something very good that people can take away from being a physician, from being an entrepreneur, from somebody who wants to start a new idea. Essentially really what I got from here is to just start and just go forth.
And be prepared. It's a long, lonely road.
Be prepared for the unexpected, but it'll definitely be a journey. Now, thank you so much once again, Dr. Reed. And thank you so much once again to everybody who listened to today's Physicians Fame podcast episode. Once again, thank you for joining us. Don't forget to catch us on our next one. And as always, stay connected.